Wait, what? UnitedHealth just sold off its entire South American empire for $1 billion. That's huge. Picture this, massive U.S. healthcare giant, millions insured, hospitals, clinics, the works, then a big exit. UnitedHealth agreed to sell its Latin American business, Bond AAHDK, to a private equity firm for $1 billion. That means Colombia, Chile, the whole regional build-up, now part of a new owner's hands. It's not just a small divestment. We're talking hospitals, insurance plans, medical centers, a big chunk of infrastructure. Bond AAHDK serves around 1.7 million people, runs hospitals and dozens of health clinics. So why sell now? Why after building all that up? UnitedHealth has had a rough patch, heavy losses, internal shakeups, and a messy reputation overseas. This move feels like a big corporate reset button. Could be smart or risky. Bond AAHDK covers millions. Think of it like owning a chain of supermarkets, in this case, clinics and hospitals across multiple countries. And that chain just got sold off. UnitedHealth had already sold off similar operations in Brazil and Peru before this completes the full South American exit. It's like a chef cooking a 5-course feast, then suddenly clearing the table and walking out. Strange, but maybe there's a plan behind it. For patients and insured folks down there, this could mean a shift. New owners, new policies, new uncertainty. Here's the no way. Line, a U.S. healthcare titan with global reach, just folded up its South American maps. That's not everyday news. Bottom line, this sale doesn't just move numbers around. It shakes up regional healthcare, shifts power, and resets strategies on a massive scale. But here's the question. What's next for UnitedHealth? Will this $1 billion move save them, or is it just burying deeper problems? Tomorrow, we dig into how this could impact global healthcare investors and maybe even you. Hit subscribe, smash that bell. You don't want to miss what comes next.